Hey everybody, welcome back for another day and another chat here with me, Ivana. And today I have got a really special guest to talk about a lot of things that I think we have all really been wondering about. Now that is the UAB School of Medicine Dean, Dr. Selwyn Vickers. And in addition to having that important job of being the Dean of the School of Medicine at UAB, he has a new role, which is being a leader on the newly created task force for the University of Alabama system. Now, this task force is looking at the safety and what life is going to look like safely on the 3 campuses in the fall. Obviously, that is probably going to look a little bit different than college life has looked for those of us who have already been to college or graduated in the past, and even from this past spring semester. Things are going to be different, and there's not a whole lot of getting around that. So this new task force is going to explore a lot of those possibilities, look at a lot of the options and the data to see what's going to work and what's just not going to work. Dr. Vickers, I appreciate you so much taking your time today to speak with us about this. I know that you're a very busy man, and this task force is a very busy group of people.
Glad to be here, and thank you for the opportunity.
Yes, sir. Now, and if any of y'all have questions that Dr. Vickers can answer, let me know, and I will pass them along. And if he can't answer them, we will do our best to get those to you as soon as they're available. But Dr. Vickers, I think that, first of all, could you tell us a little bit about what this task force is and what kind of things you and your colleagues are exploring?
You know, the task force is really to look at, provide a plan, and maybe if you would a map for how campuses might return to some level of engagement of their student and their faculty around all their missions in the fall. And it's to think about what's the safest set of principles that we would follow in order to bring people back in some order that we would limit further re-exposure and further emergence of the COVID-19 virus.
And this task force is looking at both University of Alabama on Tuscaloosa, University of Alabama at Birmingham, and the University of Alabama in Huntsville. So those are 3 very different campuses, very different cities, and they just have different factors that are going to affect all of those campuses. Is that something that y'all are taking into account in your research?
Absolutely. You're right to highlight that there are 3 distinctive campuses with different scopes to some degree and missions of what they work on. The University of Alabama really is a flagship state school with a large student population, large faculty, and engaged with that faculty with research as well. UAB, as you know, is an urban campus that has a full-fledged academic university, but then has a real breadth of public health-related profession schools, including public health, medicine, nursing, dentistry. All of those distinctively make UAB a little different. And then UAH, again, a regional school that has a pronounced engineering and aerospace focus, very connected to the culture of Huntsville around science. Not as much of as a on-campus living residential campus as the others are, but growing in that area, but has a lot of commuters as well, like UAB. So you're absolutely right, very distinctive. So the task force won't try to basically be completely prescriptive to each campus. It will be made up of representatives from those campuses who will be able to put together a plan under some broad principles that I believe the task force will put in place and that everybody will agree to try to follow.
Can you tell us a little bit about who is on this task force with you? I know you're one of the leaders, and the UA System Chancellor, Finis St. John, had appointed you to that role. Who else are you working with on this task force?
So there's certainly a number of people. The other co-leader is Katie Osborne. She's one of the senior leaders in the UA system, is an attorney by training, but has been a key person around compliance and is very capable and leads another task force already that's related to COVID-19. And then the other components are now being put together. There will be representatives from each campus, including some of their senior leaders, as well as there will be a group focused obviously on the medical side of things that will relate to health and safety for actually putting together a strategy that would allow us to return students and return faculty.
And I think it's fair to say this is not going to happen in the summer. Summer semester is not what we're talking about here. We're talking about fall. And in the fall, I think a big question people are wondering about is, are we going to be able to have class on campus? There's a lot of classes that are very difficult to do online, and there's a lot of students who don't have reliable internet access maybe in their home area. So what kind of things are you looking at to see if it will be safe for students and faculty to return to in-classroom teaching? And also what kind of, what kind of guidelines could that look like?
I think from the broadest principles that we know about any process of reopening, we know, number one, we need to continually, but in this time period, develop an easily accessible and robust testing capacity. And testing in two forms. That's the ability that when someone either has symptoms or had an exposure, that we actually can quickly assess whether they're COVID positive. Not, as we remember, we began probably in March, every test available was a 7-day wait period before you got it back. We would hope that that testing period will be something less than either 2 to 3 hours or a day at most. That person would get that back. And there's evidence, just as this virus has changed almost every week, we believe and hope that our ability and our technology will also be continually evolving as we get closer to the summer. So we've gone from a 7-day period to where there's a platform now that probably can give you a test result in about 5 minutes. So those are important factors that will be key. The other testing key is testing for those who've been exposed with serology tests that have they have to have a very good specificity, because there are almost 100 of them on the market now, and many of them are not very good. So having a real credible serology test to know who actually has had exposure and has some evidence of antibodies and what level of antibodies. Then I think with that platform, you still want a set of principles that people are very aware. Until we get a vaccine, we will be different. We'll be back to a new normal. I suspect there will be some rules around mask and wearing face masks. I suspect there will be rules still in place for social distancing. And then I think it will become important for us, before all of this begins, to see a downward trend and to know for that campus site that there is a significant evidence that the virus is not continually escalating in the new cases. I would tend to think that would be the case, but God forbid we have some rebound around August and we're seeing a period of downturn in June and July, but lo and behold, because of some other factor, we get a rebound. We'll have to keep that in mind. That's not what we're hoping or expecting, but we know it's possible. And then finally, I think there has to be, which I think students will be really good at, there really will need to be a level of easy and fairly sophisticated tracing, so that when a student or a faculty member is identified to have COVID-19, there will be a credible way to trace those individuals who they've contacted and get them in a position of a 7 to 14-day quarantine to get them at least out of the field of further transferring the virus to others. Those are some of the basic principles that we will need to have in place. And then we'll have to be creative to adjust what do dorms look like, how you do the classes, which part is it hybrid, online, some in person, what's the density look like, how do you eat in cafeterias, all of those things. And then how do you work around sports? All of those things will have to be probably creatively done to limit the risk and injury to human life, but also allow some movement back toward a normal world until we get a vaccine done.
Well, and you're so right. You talk about, there's a lot of factors here, and you even say that in that little conversation. And one thing that I know, I did graduate from UAB, and I think UAB, along with a lot of colleges, and especially the 3 UA system universities, no matter how big of a school you have, or no matter how big your classroom is, a lot of times you're in a situation where you're sitting next to a student next to you that is less than 6 feet, especially I remember my history classes had just long tables. It wasn't an individual desk. And a lot of times in these classes, especially our freshmen and sophomores that are in some of these kind of 101 classes, they are full. They're full to the brim. So what are some of the things that y'all are thinking about? Are you going to have to reduce class sizes? Are you going to have to make sure that there are 2 seats in between the, student A and student B? Are these things that, I know that they might not as technical as some of the public health aspects, but are there things that you're thinking about just kind of on the practical level?
So we haven't engaged that conversation, but we will. I think, as I mentioned, this issue of social distancing as well as the issue of density are going to be important. And if you look at really the places where the disease has had the most havoc, New York City, New Orleans, Chicago, Detroit, the density of those populations have had a real basis for the virus really having its way with the population. So yes, I think that short of, and not sure what our capacity will be, but short of testing every student to say that because you're negative, you can go in, or because you have antibodies, you can go in and behave like you were a year ago. That's not clear that we'll be able to do that yet. I think even if we are, you'll have to test them frequently, because somebody can go to some other event and now get exposed again, even though they were negative last week, they may be positive next week. So with that principle in mind, I think we'll have to be vigilant about people's symptoms. We'll have to have them wear masks. I think we'll have to have them understand about keeping clean surfaces and contacting, not in the typical social ways that we've done before. And I think we'll have to think through the principles of how do you create that space, right? And the principle of that is based on the fact that the virus can be spread through our respiratory flora, so that when we speak or when we sing or when we yell, we can spread the virus. And the belief is that 6 to 8 feet is a distance that limits that ability to get inoculated. So I think we'll have to think about how we honor that in light of the fact that we'll be imperfect at some level of trying to decide who completely has no risk or who has the virus.
Right. And then you talk about density, that goes back to, like you mentioned, dorm rooms. I mean, I think that we've all been in dorms, and again, no matter how new or great they are, it's a dorm and you're going to be pretty close to each other. That's kind of the nature of the whole thing. So it's going to be something that I think y'all are definitely going to have to think on. I'm sure you already have, about how you do that, how we deal with dorms. Something else that I know is a huge thing for college life in the South, whether you're at a UA school or not, is football. Are other big events, no matter whether sporting events, they can be, Greek life events on campus, or other organizations that are putting on events. And that's just a big part of college life, is gathering and doing these things together, whether it's sports, football, or again, a charity function or something like that. So how do you balance having a college life and doing these activities that you and I and a lot of people have done with, that maybe a freshman class that are going to have a totally different experience, at least this coming semester?
Yeah, I think first of all, there will have to be a great deal of robust communication. One of the biggest challenges of this virus is people often react based on their own personal experience versus what they see or could learn from other communities. So a lot of things in life, we're better off by learning from others' mistakes versus having to do it ourselves. But unfortunately, being young doesn't always resonate with that. Many times young people prefer to experience. So it won't be easy, but I do think in the context of this, where we are now in April, it will be interesting to understand where we will be as a state and a region in August and September. What I would say is that I don't think that the perspective of how we have to behave in a group setting or in the public gathering space will change that dramatically because we won't have a vaccine by then. What I think will be important is whether we have the ability to put those factors in place, whether we have really rapid testing for tracing, that is serology, or testing to see if the virus in mass numbers. And that's why you've heard leaders speak that although we're doing 150,000 tests a day, some would say we need to do 3 to 5 times that number. So significantly more nationally. And that doesn't take into the serology testing where hundreds of thousands of people are tested in order to understand whether they've had antibodies. So those factors will be really important to what degree people can come back and gather in some significant space. I would say that also, even with those testing, they're not perfect. We're going to have to still have some principles around the distancing and density. So it's yet to be seen where you can put 100,000 people in a stadium and have both the people be comfortable, but also the leaders in the institution be comfortable that that's safe. I don't know that anybody's documented or developed a plan around what that looks like. Is it a density or 20 to 30% full, so that you keep people spaced out, but you have some crowds and you still have televising rights and you give people a lottery to choose their games they go to? Uncertain, but I suspect there will be recommendations from college campuses to their conferences to think about a set of principles that will be pervasive probably around the conference about how they will handle those sports that have large numbers for that to occur.
So you think these are conversations that are going to be happening? Obviously, like you said, this is an ever-evolving situation. This is changing,
yes.
and we don't know what's going to happen in a week from now, let alone several months. But you do think these are conversations?
I think they are. Yeah, I think they are, because I think maybe, 6 months ago, I should say not 6, maybe 2 months ago, in January and February, we probably hoped this would be over in April and we'd be back to normal, or we didn't expect it to be that infectious. We didn't expect that many people to die. Fast forward 2 months since February, we know it's not going to be over in April, and we know a lot of people can not only get sick but die. So that changes the whole frame of thinking about how do we keep people safe, particularly young lives safe, because the nature of the virus, obviously a lot of people simply get, sick and get better on their own, but there are a lot of people who actually get very ill and don't do well. It's an illness that we are still documenting the damage it does, and we still don't know the long-term impact it's going to have on the bodies of people who've been infected.
I think that you are in such an interesting position to talk about these issues, because not only are you a medical doctor, you are also a dean of the School of Medicine at a university that has a lot of undergrads, a lot of young people. And I think that you have got an interesting perspective, because you get to see freshmen in, freshmen in their medical year. So maybe not, undergrad freshmen, but I would love to know what you are seeing from the students in the medical school, and people who are expected maybe to have a year filled with certain courses and classes, and now are completely turned upside down by a pandemic that even their professors don't totally understand. And I think that is really interesting for this new wave of doctors and medical professionals that are going to be coming into the world after this pandemic.
Yeah, I think even for undergrads or the medical students, I think all of them are remarkably resilient. And you might not see it, but if you remember back to your undergrad days, just the things you were able to accomplish and get through, I agree that this has been a world turned upside down for both faculty and students who didn't necessarily plan that most of their curriculum and their experience and their gaining knowledge was going to be through an online mechanism. I think that there is a modest amount both of frustration, wondering, am I getting the best opportunity? But I think it's overcome by a significant understanding that this is something no one wished for or wanted, but they're trying to make sure that I get the best opportunity. And it's not isolated to us, it's everybody in the country. So I'm not alone in this. Every student is experiencing this because this is the standard that we know to protect people. So I think it's probably mixed feelings. For our medical students, about 60% of their activities are not in the classroom. That's something that's been required for medical schools for a few years now. So they're used to a lot of their activities in the first 2 years being online, and they are able to adjust. I think in the clinical years, that's been harder because many of them, those years are largely about hands-on experience and seeing patients. But our national leadership has made it clear, which we fully agree, we don't want to put them in harm's way at this stage of their careers. And so they've been pulled back from those areas, which are in the case in the hospital where there has been a risk of exposure to COVID-19, and they've been online as well. But we're planning to return them back to the hospitals and clinics in toward the end of June, that we would expect them to have a chance to go back and start engaging with patients.
Is the task force or the UA system at large worried about enrollment for the fall?
You know, I don't know. I think, so I can't speak for the provost of each of the campuses, but I think in any scenario, when there's some global upheaval to things that affect people's travel and daily lives, yes, I suspect you do worry about what impact this has on kids going to college or choosing to do so. You've highlighted that part of the reason they go to college is certainly to further their education and gain a skill, but it's also about the social experience. And for the entering class and for those who are in juniors and seniors and sophomores, it will be different at least for a year before we return back to what they have typically thought about the college experience.
And I know that this is especially true for UAB, that there are a number of international students that come to attend college here and to attend their classes here. And you know, it might be one thing where America might be in one place during this pandemic and other countries might not be. Are you having these conversations, or is a task force having these conversations with the offices that handle international students and international enrollment?
Absolutely. They're integrally engaged in the conversation about how to manage the international students, how to deal with if they are away from America and their return, how to manage that, and if they are still here. Absolutely. That is at the forefront of those leaders' minds because, as you mentioned, UAB has a number of international students who have been a vital part of our culture.
And finally, I think it's really interesting. You've talked several times about tracing, and we've heard a lot of things nationally about the development of different apps or softwares to trace and maybe alert phones that are smartphones that are within a certain distance of you, which is just technology that's way above my head, and I think a lot of people's heads, because it's mind-blowing and amazing in that people can develop that. But do you envision something like that for the campuses that would maybe be integrated in a campus app or something that would be required for students? Or do you think a lot of that tracing would be on the optional side?
Yeah, I would love to see that to be the case. When you look at the experience, President Trump had a conversation with the president of South Korea last weekend, and it was about the remarkable scenario of 60 million people. So a country that's significant in its size, as big as Italy, but only had 8 new cases for the entire country. And many would argue that the methodology they used is built on a technology base that when a person who's positive is identified, all of their contacts, both where they've been and who they've contacted, are immediately sort of notified. And in fact, what's sent out is basically an emergency distress signal on your phone. And you're required to download that when you enter the country. That distress signal takes you to a space where you can read where the person who was infected was located, and then it tells you where they've been and where they, to some degree, where their residence is. So it gives you a platform to know how to avoid getting infected, and it also has a lot of specificity toward those who they've connected with to go get testing. I think everybody believes that, particularly in areas like college campuses where there are a number of people together in some tighter space than a broader city, that a tracing mechanism would be really vital and a critical part to be able to do so. Whether it's an app or whether it's a web-based model, I don't know what it would be at this time, but I think it's a vital part of our success going forward for kids to be able to take advantage, to protect themselves, and to prevent further damage to their campus and other individuals by knowing when someone's positive and who they've contacted.
That's just incredible. That technology is something that is it's crazy to think that we can develop, and especially in a short period of time. I know those things are still being developed here, but just the technology is something definitely to be respected. Is there anything else, Dr. Vickers, that I've missed that the task force is working on? I know, like we said, there's a lot of unanswered questions and a lot of things that y'all are having to just wait on information before deciding.
Yeah, I think one of the global perspectives is that this is temporary, and it's not a permanent process, and we're going to get through it. So I think we need to be wise and judicious to make sure we protect and keep people safe so that we don't create permanent harm. And although I think there's a lot of anxiety to get to the next phase, I think it's very clear that we have the ability to understand that perspective and make wise decisions for the best interests of our students who have a long life ahead of them. And this will be simply a blip on the map they will remember, but one hopefully they remember and understanding with some fondness and appreciation of how they got through it.
That's great advice, Dr. Vickers, and we appreciate you so much and all of the information that you and the task force are working on and getting out to the public ahead of college starting back in the fall, hopefully football starting back in the fall in some form or fashion. And we appreciate it, and thank you to all of you for watching, and for the rest of you, we will see you tomorrow.
Thank you.